Now, when answering testing questions, just a reminder, these are your outline of questions of the question types that you're going to get on this exam. You have your general multiple choice, your fill in the blank. These generally may be your formula questions where you have to calculate your medication dosage or maybe a burn per area percentage, and your multiple response type question. Your multiple response is very similar to your SATA or select all that and apply. Ordering response. So in what order would you be your priority nursing interventions? Generally in your ordered response type question. And then also your graphic or chart. So often you'll be given a chart and you'll need to look through that chart and reference that chart to find the answer, to find the correct answer for your patient. The other graphic type question that you may get is the patient is, you're given maybe some, or audio video, you're given breath sounds and then you need to select the area where you would need to assess for the breath sounds. Okay, so that's an example of a graphic type question. So these are your general question types that you'll be getting. So just kind of understand what it is. Usually know that when you are doing fill in the blank, or it's asking you to round, it will tell you where to round. They will tell you where to round. So that's kind of a relief and helpful in general. Okay. So please, if you have any questions as we go along, please feel free to put questions in the chat, and then I'll go ahead and answer it. I'm just trying to check out the time here. Now we do have, okay, so let's talk about what it looks like when we're answering questions. Okay, so we do need to answer questions. I did talk about a process. Make sure you have your process down pat. Okay, when you're approaching questions, think through a process of, not a formal process, but think through a process on how you're going to approach the question and use that every time. You may not need it every time because you'll know the answer will come out quicker. However, excuse me, when you use your process, it will never fail. You will always plug it in and then it will continue. It will just kind of give you that rhythm of answering questions, and it kind of gives you definitely use this process when you're going through your study questions, and it will give you a way to think so that you're thinking through the process, and that's the way you approach every question when you get on the test. Okay, so identify the problem. Okay, so decide if the question first is your assessment, diagnosis, planning, implementation, or evaluation phase of care. Okay, so you want to kind of figure out which part of care it is after you read the assessment. Then excuse me, read each question carefully from the first word to the last. Okay, so don't skim over the words or read them too quickly. That's very important for step number 1. So step 2 is, what do I know about this diagnosis? What do I know about this medication? What do I know about this disease process? What is, as part of your assessment, what do you know? Think about what you know and outline what you know about that disease process. And do this before you even look at the questions, okay? The disease process or the medication is important. And then just kind of knowing offhand. I'm going to pause for a moment and then step 3, what is the concern that you need to address? Okay. Think about applied Maslow's here. What is the hierarchy of needs and what do we need to address if it's a priority question? And then 4, set priorities. What's your worst case scenario in this? I'm hanging on here, ladies, hanging on. And then 5, evaluate. So you want to reread the question to determine what is it asking. Okay, so don't overthink all the info to make a determination of the question. So don't overthink, and then you're going to reread the query of the question. What is it asking me for your answer? Okay, so let's go through a couple of scenarios and questions, and let's see if you guys have any questions as we kind of go through that. Okay, so I think we have enough time for at least 2 questions that we'll go through here.